Good evening and welcome to our COVID-19 update. I'm Ladi Akeredoluale. Here are the highlights at this hour. Federal government to launch high-level platform on reproductive, maternal, child, adolescent and elderly health plus nutrition. Rural areas, COVID-19 protocols in low compliance as residents ask for government help. And Europe records more than 100,000 new cases in a day for the first time since COVID-19 pandemic started. We'll start off with our story on rural communities and the COVID-19 compliance, and then work our way back to our earlier stories. Shao community in Moro local government area of Kwara State has appealed to the state government to provide more face masks and hand sanitizers to enable it cope with the COVID-19 pandemic. The community leaders say that even though most of the community members refuse to observe COVID-19 measures, continuous enlightenment will help change the narrative.
Shao community in Moro local government area of Kwara State is inhabited mostly by farmers, a few Yoruba and non-Yoruba indigents who are settlers. Like most rural communities, not many seem to know about COVID-19. Some leaders of the community affirm the existence of the virus and note that several efforts are still being made to enlighten the people.
Everybody, either in the market, in the church, in the mosque, wherever you be, especially where people more than 2, 3, 4, 5 are there, we mandate them and force them to use mouth mask.
The situation around shows that not all people observe the protocol as they move about their businesses looking unperturbed. The compliance was effective during the lockdown, but people appear to have relaxed as a little percentage of the community now complies.
I'm very much aware of COVID-19, coronavirus. During the lockdown, people were complying very, very well. In fact, I can say 99%. But these days, apart from the school pupils, apart from the church, apart from the mosque, the complying percentage is very, very low.
Since we are aware of the COVID-19, we have let our students and the teachers aware of this pandemic disease, and we put in place the little measure at our own capacity. We call the students and the teacher that they should put on their nose masks regularly, they should maintain social distance, and as well to sanitize their hand by washing it regularly, often, and as well to use a sanitizer.
According to the Presidential Task Force, COVID-19 is still very deadly. So far, everyone, including residents of Shao community, must continue to adhere to the NCDC protocol to avoid more infections in the community.
Scary situation. Meanwhile, in Osun State, physical distancing, the use of face masks, regular hand washing, and other safety protocols are some of the measures experts say has shown that community transmission can be contained. But the practice is far becoming abandoned, as observed by our correspondent who monitored some of the motor parks where students bought vehicles to their various schools. Some of them who spoke to Channels Television attributed the development to the drop in cases recorded and to what they call inconveniences with the use of the face mask.
We are beginning to feel relaxed because, in this part of the world, once we get rid of something and after a certain number of times, we feel relaxed, we forget about it, even from the talk. So that's how things have been, and it will continue to be like that until we change our attitude towards it.
It's not part of us. It hasn't become part and parcel of us. So most of the students, they don't like using it, mostly. So that's the observation. I think those students, they don't like it. And majority, it's not even only students, majority of the people, they don't like it.
They may look at it the virus has actually gone, which is not actually so. Like some will be in ease of, or probably forgetting the face masks or not keeping the social distance. And that could have been the resultant effect of what you are seeing now.
The Lagos state government has granted pardon to actress Funke Akindele and her husband Abdul Rashid Bello for offences related to the disobedience of COVID-19 lockdown regulations. According to the Director of Public Affairs of the Ministry of Justice, Mr. Kayode Oyekami, he noted that the couple was granted pardon because they were non-custodial convicts. The statement reveals that 56 other inmates from various correctional centres were granted state pardon after due examination of their case files, length of time served, offence gravity, old age and ill health, amongst other parameters. The Attorney General of Lagos State also enjoined the beneficiaries to be good citizens and stay away from crime. All right, let's go to our lead story about the unveiling of the federal government health plan. And the federal government says it is committed to realizing global commitments on the Sustainable Development Goals 3 and 5, as well as the attainment of universal health coverage, leaving no one behind. Addressing a news conference in Abuja today, the Minister of Health, Dr. Osagie Ehanire, says a high-level platform called the Nigeria Reproductive, Maternal, Newborn, Child, Adolescent, and Elderly Health plus Nutrition Multi-Stakeholder Partnership Coordination Platform is to be unveiled as part of efforts to attain SDG 3 and 5. The minister explains that issues that confront the health of the family in Nigeria are multi-pronged and require an integrated, multi-sectoral approach that no one institution can handle. He adds that the emergence of new issues around gender, public health emergencies, and most recently COVID-19, with attendant limitations in providing access to equitable, quality healthcare services, has become an area of concern for global health and security.
There is no doubt that the COVID-19 pandemic had its toll on routine healthcare delivery around the world and, at the initial phase, severely impacted services in Nigeria. However, lessons learned from the COVID-19 pandemic are being utilized to strengthen our health system and reposition it for more resilience to improve health and well-being of the vulnerable across the population life cycles of children, adolescents, women, and the elderly. In realization of our vision to achieve universal health coverage while leaving no one behind, the Federal Ministry of Health is repositioning its approach to partnership to maximize impact for better outcomes.
As part of efforts to deliver quality healthcare to the rural population, the Imo State government says it is set to commence renovation of at least one primary healthcare center in each of the 305 wards of the state. The Executive Secretary of the state's Primary Healthcare Development Agency, Dr. Perun Njoku, disclosed this in Owerri, the capital, while taking delivery of some medical equipment and PPEs donated to the government by International Health Organization Marie Stopes. Dr. Njoku says the state government has completed the needs assessment of infrastructure and basic medical equipment for the upgrade of primary healthcare centers across the state, which will go a long way towards fighting deadly infections.
The most important thing His Excellency has done for us is to give us the enabling environment, and again, putting in place, because of his drive for the primary health care, we are just about starting to renovate at least one primary health center in each ward, in the 305 wards of Imo State. We've already concluded the needs assessment, both for infrastructure and basic medical equipment. We've also concluded the assessment for HRO requirements. And good thing, with his encouragement, we've been able to qualify for assessment of the Basic Healthcare Provision Fund in order to boost the government efforts.
In Ekiti State, pensioners are agitating and have rejected any attempt to increase the level of deductions from their gratuities. The protesters told our correspondent, Babajide Agbeyo in Ado Ekiti, that already several deductions have resulted in them taking much reduced deductions from their entitlements.
Pensioners in Ekiti State protesting what they call a breach of agreement by the state government as regards underpayment of backlog of gratuities. The pensioners and government had in July agreed to some terms prescribed by a financial institution engaged to help defray the about 14 billion naira gratuity arrears with 15% or less deductible from the benefits of pensioners.
Like we said from the onset,
but the retirees are expressing shock and disappointment that the term has changed to as high as 25%, as reflected in the forms rolled out for the purpose. They call for the halting of the ongoing process and fresh negotiations with government.
The government got back to what it did the first time, which we complained about, released some documents and made radio announcements without the knowledge or informing Nigerian pensioners. They gave old men, retired civil service, retired senior citizens, 5 days, including Saturdays and Sunday, to collect forms and fill and return, giving us a deadline. That is something which is not acceptable to the union.
Successive administration have not been paying these areas of gratuities. We have paid for about 1.2 billion in respect of that. But we still discover that even if we continue to pay 100 million monthly, we will still not be able to pay. I mean, all within these 4 years. So the governor now feels that it is only right that we should approach financial institutions for assistance.
In its reaction, the state government insists it has not reneged on its agreement, saying discrepancies noticed will be corrected while accommodating fresh negotiations if pensioners insist.
In furtherance to its commitment to enhance a safe environment in the era of COVID-19, the Taraba State Governor Darius Ishaku has flagged off the construction of a 5 million-litre multipurpose water reservoir in Jalingo. The project has facilities that target meeting the water needs of urban areas in Taraba State from 2021 to 2035 at a cost of 8 billion naira.
Taraba State, on the other hand, in collaboration with her development partners, has made steady progress in water services delivery to our people, notable amongst which are: 1, the execution of the urban and sanitation improvement project supported by African Development Bank, aimed at upgrading and expanding water production and distribution to Jalingo as the capital city, and reforming the sector institutions. 2, the ongoing 8 billion Jalingo Primary Water Source Project, fully funded by the state government at Saminaka, to boost water production by 28 million liters daily, an additional storage of 5 million liters, in addition to the effort of the African Development Bank's supported project to cater for the influx of people into Taraba State from other states in the region, which has stretched our water structure.
Let's take a look at the latest figures from the Nigeria Center for Disease Control, the NCDC, which has announced over 100 new cases of the SARS-CoV-2 virus last night in the country. The 103 cases were confirmed in 12 states and the FCT, with Lagos topping the lot at 39 cases. Rivers, which recorded the second highest caseload in 24 hours, has seen a daily case count since Monday, the 5th of October, totaling 136 cases. 148 people recovered from the virus. This was reported in 10 states. Plateau has 56 of those, Rivers 33, Oyo 30, Edo 8, Katsina 7, Imo 4, Kaduna 3. Same with Bayelsa, while the FCT and Osun have 2 each. Till date, the total confirmed caseload continues to inch closer to the 60,000 mark. The exact number is 59,841. And the death toll remains the same at 1,113 since last Saturday, that's October the 3rd. And one hopes it stays that way. Let's talk to Dr. Adegboyega Akitola, who is the Deputy Secretary of the Nigerian Medical Association in Lagos Zone. Thank you for your time. Thank you for coming in.
Thank you very much, Ladi, for having me.
Let me begin with these figures, the NCDC figures. As I've asked everyone who sat in the chair that you sat in and who is a medical practitioner, are you happy with the drop in the number of cases?
Definitely, of course I am. I'm happy. It's not just myself, it's a collaborative, emotional expression, because when COVID-19 did hit the country, we were wondering, like, how are we going to handle this pandemic? It started from Asia, the Americas, we had returnees coming back into the country. And from there, we started having, gradual increase in number of cases. However, the Deputy Incident Commander, Commissioner for Health, Professor Akiabayami, did, give presentations elaborately on how, the curve was going to, play out, and gladly we are at that phase where we're peaking, or let's say we peaked, and we're coming down. So it's a thing of joy for Lagosians, for Nigerians, that we have the numbers dropping as opposed to developed countries where we're still having spikes.
Well, the other part of this, of course, is that people will point to the fact that we are doing less and less tests every day. And that if you don't test, then you can't find the cases, can you?
Definitely. Absolutely correct.
How about that?
As regards testing,
yes,
it's more of we still sensitizing, the public, to take up testing. We have already as regards the intervention response for COVID-19, it's been decentralized in Lagos State, all thanks to Mr. Governor, who has been working assiduously hard with his team, the Deputy Incident Commander, Professor Akiabayami, and all the stakeholders who are involved, public health physicians who are at the grassroots level, providing healthcare at the community. And it's been said that when it comes to having these numbers coming down, a lot is involved. There are a lot of linkages. It's not just about testing alone. It's about also social mobilization, information, awareness at the community level, at the ward level. People need to know about this thing, this condition, and that it hasn't been eradicated. People are moving about their daily activities, feeling, okay, we have the numbers dropping. The lockdown has, been taken off. We're going about our livelihoods. But that doesn't negate the fact that it is still within the community. We still have some level of community transmission, but however, government has been able to decentralize the response. Now, it's been taken to the community level. At the LGs, every local government in Lagos State, the 20 local government areas in Lagos State have walk-in sites, testing sites, where you can walk in if you feel you have symptoms of COVID-19. You walk into the center, get yourself tested, and you have your report, your result communicated to you via electronic platforms under 48 hours.
Let me put you on pause. We'll take a break. What you said about Lagos is true, but other parts of the country where COVID-19 is don't have the same level of facilities. But we'll talk about that as well as what's going on in the rural areas. That's right after this break. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Dr. Adegboyega Akitola is still in the studios with us. Dr. Akitola, before we took the break, we were talking about this issue of testing and the issue of facilities. Lagos, of course, being the epicenter for so long, developed so many of these facilities. But then many other states put in place some facilities, but almost immediately shut many of them down when they said they had no new cases. Some of them shut down the isolation centers, some of them shut down some of even the treatment centers because they were celebrating they had no cases. That's why the issue of testing
is paramount.
Is very important, because if indeed they have no cases, then we can celebrate, can't we?
Yes.
But you've told us we can't.
We can't, because apparently, according to the reports from the Presidential Task Force as of September 4th, 2020, it was said that COVID-19 is still in town. It's still ferocious. It's still killing people, especially people who have comorbidities, diabetes, hypertension, and the likes. As regards what you asked,
yes,
it's two things, There's no testing done there. And we all know science has been evidence-based. You can only talk about or make informed decisions as regards quality data you have from your team or from the strategic, response team, issued out to the public. If the team decides to go to bed by not testing and, in quotes, say there is no COVID-19 in the state or no new cases, well, that's left for that state to deal with, honestly, because I believe testing needs to be done on a massive scale. In America, we still have the figures still rising. We had the highest number of cases globally just yesterday since the inception of the pandemic. So that still goes to show that there is still a lot to be done. We just can't sit back and relax and say, okay, we have cases coming down in this region, this geographical region. Okay, everybody should go. No, we still have cross-migration happening. People, the trans-border travel, the airspace has been opened. People are moving. People are crisscrossing about their business. And
the PTF, just sorry to quote in, but the PTF did point out also at the last briefing they held yesterday that 22 of those who have come into the country since they reopened international flights have tested positive. Those who came in through the airports, that is.
Exactly. And don't forget, we just don't have the airspace is not the only route of entry into any country. We have the land borders, the international land borders. Take, for example, in Lagos, we have Badagry, local government area. We have the international borders within Badagry West, local council development area.
Right.
There are two international borders there. You have one in Seme and you have one at Owode. Most of the elites, those who come in legally, come through the Seme border route. I was opportune to be an active volunteer for the COVID-19 quarantine response in Badagry. And we had a lot of people coming through the Seme land border when the airspace was shut. And we were able to follow through the NCDC guideline protocol in conjunction with the Lagos State Ministry of Health. That way we were able to mitigate, reduce, the number of cases by starting off with the quarantine procedure. For those who were positive, they were evacuated to the isolation center for treatment. And afterwards, having gotten treatment, reunited with their families. And that was the sequence till quarantine was stopped at the end of May 2020, as announced by the Minister of Foreign Affairs, Geoffrey Yema, where quarantine was officially stopped. Now, the NCDC stepped up again with a new protocol where even quarantine has been reduced to 7 days, no longer 14 days. That is, you come in, you have your testing done. If within 7 days you don't show symptoms by under quarantine or self-isolation, by the 8th day,
you're free to go.
Exactly. So But the challenges that comes with testing, especially in rural areas, is the fact that most of these community members within these rural areas, rural suburbs, Badagry, Ekwe, Ikorodu, some parts of Ibejuleki local government area, still believe it's a myth. Still believe COVID doesn't exist. Probably though they haven't had loved ones around them, fall victim, or, being added to the mortality numbers or statistics. But however, the truth is, I believe there's a need for social mobilization, for awareness at the rural suburbs of the country. Because information is key, knowledge is power. If you're informative about what's happening around your space, around your environment, that way the community can thrive and can make better productivity.
Well, the other part of this is, of course, you did mention the rural areas. And in terms of the rural areas, it seems as if during the last 6 or 7 months that this pandemic has been in Nigeria, most of the efforts have simply overlooked the rural areas. They've been concentrated more in the urban centers, the state capitals, and other such semi-urban centers. The rural areas where you have farmers, some level of artisans, low levels of literacy, absence of means of communication, like the community in Kwara State from which our report came today about the rural, what's going on in the rural areas. As you see from the pictures there, nobody, not a single person is on a face mask or is talking about social distancing or any such thing. Now, at this level of community, are we not incubating, again, further crisis for ourselves, even if we manage to squelch that which we currently are handling?
Yeah, well, you're very correct with what you said, but that's for some parts of the nation.
Yes.
I will give Lagos for an example as a study area. Lagos has been able to do so much. As regards, I talked about earlier, decentralization of the COVID-19 surveillance response.
Yeah, but even in Lagos, people are not coming out for testing.
Yeah, that's the thing I said about, especially rural areas. They still have that myth that it's not. That's one. Secondly, in the rural areas, they usually don't have enough sensitization. But now the government has gone as far as coming up with an intervention called the Community Home-Based Care Intervention Program, where healthcare workers per local government, per ward, are being trained extensively on integrating the state response or whatever, the national response, down to the grassroots level. And this involves a couple of personnel, ranging from the medical officers of health, to the medical officers who are case managers, to nurses who are also case managers, to disease and surveillance notification officers, they call them the DSNOs. The CHUs, these are people who, some of them, go into the community and enlighten each, neighborhood. As regards, they have mass media campaigns talking about COVID-19. Please get tested. If there's anyone in your home or in your family who's showing symptoms or signs, this is a number to call, this is a number to reach. At that point, whatever happens, it gets escalated back upwards. The incident case manager, who's the medical officer, comes down to the house or the home of the suspected case and interacts with the COVID-19 protocols in place, the distancing and all. Do you understand? Depending on the severity of the case at hand or at presentation, that will determine the line of management. If it's a mild or a moderate case, it can be managed at home. And we already, the state government has extensively drawn up protocols for this as regards mild, moderate, and severe. At this level, we have just severe cases going to the isolation centers for treatment. moderate and mild cases can be managed at home with different management protocols as designed by the states. So that's about it, basically.
Well, before I let you go, I'll ask this one final question. Looking ahead now, I mean, with everything we've spoken about, where we are now, if indeed the numbers are coming down, but we still need to do a bit of testing, what would be your advice to those who are managing the process now? What do they need to do now to ensure that if indeed the curve is coming down, it stays down and probably comes possibly to an end, if one can use that phrase?
Well, I strongly believe that it's a collaborative effort. It's not just a one-man show, starting from government to the public space to the private space, stakeholders. We all need to be at alert that COVID is still within the system. We still need to enforce these guidelines and protocols instituted by the NCDC. We still need to ramp up testing. A lot of people still need to be tested. A lot of advocacy still needs to be done. Mass media needs to be pushed out there, especially to the populace that do not have access to social media or any social element that can actually provide such information for them. And that's where, for rural areas who are kind of like disenfranchised by the way of reasoning or the way of the thought process, they should be reached out to. We should reach out to them. We should get them tested. We should sensitize them to come to the walking centers to get tested. That way we can capture high quality data to draw on inference and make an informed decision as regards COVID-19 being eradicated in Nigeria. Dr.
Akitola, thank you so much for coming in. It's been a pleasure having you on the program this evening. Thank you. Outside our shores, despite the increased freedom under lockdown level 1, South Africa's active COVID-19 cases continue to drop overall, albeit slower than prior to level 1. The country is now 10th in the world with 686,891 total infections, while the United States remains at the top of the list with 7,833,763 cases. India is second with 6,906,151 cases, and Brazil is third with 5,029,539 cases. While South Africa's continued downward trajectory in active COVID-19 cases is cause for optimism, appropriate protocols, including social distancing, the wearing of masks and hand sanitizing remains in place. Let's talk to our Bureau Chief in South Africa, Betty Dibia. She joins us via Skype from its commercial hub in Johannesburg. Hi, Betty. Nice to see you.
Hello. Same here, laddie.
Let's start with these numbers. Cause for optimism, cause for concern. What should we make of them?
Well, cause for optimism because the recovery rate has remained quite steady in the past week or two at 90%. The numbers you called out have increased slightly today to 688.5 thousand. So it's quite steady. We've seen worse days. So now what is worrying government or what has ticked off government a little is a slight increase in the rate or the number of fatalities in the past few days. On Wednesday we had 145, Thursday we had 160, and today, that's the 24-hour cycle, Thursday into Friday, we've seen 139. So they had looked to the Medical Research Council to find out what's going on, because we had gone down to double digit. Now returning to 3 digits is what worried government. So the health minister has said that according to the Medical Research Council, that the provinces have heeded to the recommendations of the Research Council to reconcile the deaths data with the Department of Home Affairs. And they're also looking or auditing the deaths data by mining data. I know I've said data so many times. Mining data from the surveillance reports, surveillance report platforms by the Institute of Communicable Disease, just to ensure, or facilities on the ground to ensure that they're reporting correctly, especially because the Medical Research Council for 3 consecutive weeks has not reported excess deaths. So probably the figures that they're having now, they're more accurate, than what they had before. But generally, the rate of increase has slowed down and the recovery rate is still at 90%. So there's cause for optimism, but as the officials keep saying, let's not let our guard down.
One of the things that people would be looking at for numbers rising or dropping in South Africa, on Wednesday, there was the strike by Cosatu, which is an amalgamation of several unions, including health workers. The reports we have indicate that there's been some kind of resolution. What is that resolution and how does it affect this fight against COVID-19?
There's no resolution yet. What they're being told is that they should keep engaging with government. Remember Nehawu strike before, that's the Education and Health Workers Union had their own separate, but this time you had the federations, not just Cosatu, you have SAFTU and the others. And these ones you mentioned, the health workers, come under some of these umbrella bodies. They've given government 2 weeks to respond to some of the issues all the issues that they've raised. And it's not just about the health workers, but concerning COVID, we spoke to a lady from DENOSA, that's the Democratic Nurses or Nursing Organization of South Africa, who said, yes, we're receiving some other allowances, but we're not receiving COVID allowance, for being on the front lines. And generally, they're talking about the 5.4% wage increase that they had negotiated with government and government had agreed in 2018, expected to be implemented. But you know what's been going on in the country. It can't really be easy for government, but they're continuing the engagement and they've given government 2 weeks to respond before maybe they go all out, because that strike started with a go slow from Monday, Tuesday. By Wednesday, they went all out to tell people to stay at home. But they've slowed down and they'll wait for government to respond. After 2 weeks, if they don't get anything satisfactory, probably the promise is that they will go from city to city to city again and do the same thing, maybe for more than a day. But this was just on Wednesday.
Talking about resolutions and compliance levels, let's talk about the general compliance levels and how possibly maybe that could have had some impact on what we're seeing in terms of the numbers. When it was moved to level 1, you expressed the view, as expressed by some health practitioners, that with this increased freedom comes increased responsibility, but that going by the antecedents, that was not going to happen. What is the situation in terms of level of compliance, wearing of face masks, social distancing, and then, of course, the issue of alcohol consumption?
I don't think people have become, I don't know, let me not put a blanket judgment on what's going on, but people are getting a bit relaxed, but there's still increased messaging that people must still be responsible regarding the issue of wearing masks and all that. We still see people around, we still see people gathering in places, and then the worry about funerals as well. So these are some of the things that government worries about. But there's continued messaging to the people to ensure that they abide by the regulations to keep them safe.
That's inside the country. How about outside the country? Those coming in, the flights, international flights were allowed from the 1st. Today is the 9th. So just over a week now. What's the situation report with that, especially as it relates to observance of the protocols for those coming in, and how this is supposed to benefit the South African economy?
There was a lot of confusion. There's been a lot of confusion. If you recall, some of the airlines cancelled flights, like the Emirates. That seems to have been resolved. Another Emirates flight came into the country on Thursday. You had Qatar Airways as well coming into the country. So I spoke to one of the officials from the, I think, Economic Development and Tourism Department in KwaZulu-Natal, where that flight went to. And I tried to find out what exactly was done. Remember, the issue was treating the crew the same way that the general passengers were treated, especially regarding the issue of the tests. You must have tests done 72 hours before flying. That would be hectic for crew members who are flying in, flying out. So the statement that was given was that they've complied and it's been resolved. So he dodged it. He didn't really give me what exactly was done. Are you now making some kind of waiver for the flight attendants or the crew belonging to the airlines? So he didn't say, he just said it's been resolved, but we know that these flights have come in after that cancellation issue that we had a few days earlier. But generally, there's no benefit yet that much because of some of the confusion. And then we have this issue of, there was a story about fake test certificates being sold at the Mozambican border for people coming in. You know, I've seen one of the tests, especially one from Nigeria. There's no picture there, and there's just the name. So these are some of the things. Are the people at the borders trained to identify which is fake and which is not? I know the danger that that portends. That's another issue. So with regard to benefiting, more business people are coming in, but is it to the extent that the different sectors hoping to benefit are expecting, or if it's really happening? I can't really say yet. They're hoping that things will become clearer as the days go by.
Before I let you go, Betty, I just must drop this in. Of course, we have had similar problems with the issue of fake COVID-19 certificates here in Nigeria. But put that to one side, and now when we're looking ahead now, level 1 lockdown is about the lowest you can get. Is there anything beyond that?
That's no lockdown at all. People having their total freedom. That's what you can get. So right now, we're looking at the 15th again of October to find out what the government is going to do. Are they going to extend? Again, once there is any level of lockdown, that means some freedoms are still being curbed, like the number of people that will gather in a place. Entertainment people are really suffering because they thrive on the numbers. Entertainment, sports, and all that, they thrive on numbers. So as long as the level is still on, some freedoms are still being curbed, and there's a law protecting government, regarding that. So by the 15th, we'll know if there will be a level 0, like no lockdown at all, just everyone be responsible in your little corner. So we'll get to hear from government if the law enabling them to curb the freedoms will still be extended on the 15th of October.
Thank you very much, Betty. There'll be, I'm sure, people who will be looking forward to that very much, and if it will happen. Thank you very much,
Definitely.
Betty.
Thank you.
Europe has seen more than 100,000 new cases in a day for the first time since COVID-19 started. The World Health Organization's top emergencies expert, Dr. Michael Ryan, says European governments must take decisive action to shut down transmission of the coronavirus, including by curbing mass gatherings to avoid more painful lockdowns. Already, several European countries have imposed new measures to curb the spread of the virus. Here's more on that situation in Europe on our Global COVID Update.
Data from the Office of National Statistics shows that an estimated 1 in 240 people in England were infected with coronavirus after cases increased rapidly at the end of September. The ONS estimates that 7,200 people a day were being infected in homes in England between September the 25th and October the 1st. The figures come as science advisors warn hospital admissions are very close to levels in early March, and ministers say cases are getting out of control. According to reports, England is expected to announce a new three-tier system for local restrictions next week. Russia has reported the highest daily number of coronavirus infections since the pandemic began, with 12,126 in the past 24 hours. The previous record was on May the 11th, with 11,656 new cases. The Spanish government has ordered a 15-day state of emergency to bring down COVID-19 infection rates in the capital after a court overturned a partial lockdown imposed a week ago. Madrid and 9 nearby cities will see restrictions on movement enforced. Over in France, the government has imposed tighter coronavirus restrictions in 4 more cities with high infection rates. Bars and restaurants will have to close, as they did in the capital earlier this week. Brussels Premier Rudy Vervoort has tested positive for COVID-19. It comes after the whole Brussels regional government went into self-isolation on Wednesday night, and a Flemish minister's office colleague died of the virus. From today, Belgians can keep only 3 close contacts, let 4 people into their homes at the same time, and cafes have to close at 11.
And that's our COVID-19 update for tonight. Thanks for watching. I'm Ladi Akeredulale. But before we go, you can take a close look at our stories tonight and indeed the numbers behind the COVID-19 pandemic. Do visit our website, channelstv.com, for more updates on the safety protocols, as well as a better understanding of what this pandemic is about and what you need to do to stay safe. You can also check up that same page for other stories in politics, business, and sports, amongst others. A fresh edition of the COVID-19 update will come up at 6 tomorrow, and there'll be, 6 on Monday, that is, as well as 9. But for now, do have a good weekend ahead. Good night.